We continue the conversation discussing the allocation for the Division of Health, Wellness and Social Protection with Dr. Faith B. Israel, Secretary of Health, Wellness and Social Protection at the THE. Good morning, Dr. B. Israel, and welcome to the show.
Good morning, and thanks for having me.
It's a pleasure. Glad that you're joining us so early in the morning. We appreciate it. And of course, an overdue conversation, which we definitely need to get straight into. Many have been commenting on the budget allocation pros and cons. And one of the main issues has been the recurrent versus development funding usage. If I'm not mistaken, it was 2.376 billion that was allocated for the recurrent expenditure and uses. What are your thoughts on that, and how is it going to be actioned moving forward?
Certainly. So it's important to understand the difference between recurrent and DP. Recurrent, for example, is what we do every day to pay the salaries, to pay the rent, to keep the lights on, to keep the telephones on. That is everyday mundane. But where we are in 2024 requires Tobago to truly catch up to our brother, sister, Trinidad. And that means putting in a little bit more of an injection onto the island to ensure that we could to catch up, because what we really want to do is be side by side as we are claimed to be in this relationship between Trinidad. What does that mean, though? It means ensuring that we have the capital finances to inject into the things that we currently don't have. And unfortunately, with a budget of $205 million total for the entire island of Tobago, to do that, it's simply not enough for us to do that kind of capital development that is required. And let me just juxtapose that quickly. We heard the minister speak about a $400 million upgrade for one of the major hotels in Trinidad. $400 million to upgrade a major hotel in Trinidad, while the entire island of Tobago has to grapple with $205 million to do everything, including upgrade our hotels, including our roads, including doing what we need to do at the Division of Health, Wellness and Social Protection. So it really is a difficult conversation that we need to have, but one that I'm glad we are having in a media like this.
It definitely is a challenging conversation. Now, for some, when they hear this, the automatic response is going to be that there were some additional allocations that would have been done outside of the 205 million underlying ministries. What would your response be to that?
Certainly. So yes, that is something that is said, but that is something that is not a practical thing that actually happens. So let me give you an example. We heard the minister, for example, speak about infrastructure in Roxborough, talking about the Roxborough Hospital, which happened already, talking about the Roxborough Fire Station, which already happened. We also have to take into consideration that the Tobago House of Assembly is a creature of the legislation known as the Tobago House of Assembly Act. This is an act that came into being 44 years ago or so. And that act specifically outlines areas that is the responsibility of the Tobago House of Assembly. So, for example, there's a talk about the airport that is being refurbed, that is being redone, basically, and that is one of the big injections into the development of Tobago, which is fine. We actually welcome that. However, when you look at the law, when you look at Schedule 5 of the Tobago House of Assembly Act, items like the infrastructure relating to wharves and airports and so forth actually falls under the Tobago House of Assembly. So the appropriate action should really have been for the government to give the Tobago House of Assembly that funding and ensure that we work together to get it done on the island. What that would do would ensure that we do what is required for the people on the island, taking them into consideration, having clear conversation with them, and ensuring that we don't do something that goes outside of what is absolutely needed, outside of what is a priority. Let me give you another quick example. WASA has been doing some amazing work on the island as it relates to, putting down wells and running pipes and that kind of thing. But because it's being done outside of the Tobago House of Assembly, because the Ministry of Public Utilities is the entity managing it, we now have some conflict where where, for example, some of the major pipelines that were laid are actually in the direct path of where a road is scheduled to go. So if we had been working together, ensuring that the Tobago House of Assembly was at the table when those discussions were happening, we would have ensured that, we don't have this kind of conflict, because we now have to go back and think about, do we move the entire road? Do we then, what do we do? Because what happens when you run lines under roads? It means that the lines are going to get, broken, and we're going to get the leaks right after. So it's that kind of collaboration that we are really, really requiring in the Tobago House of Assembly space, because we are the ones who've been elected by the people of Tobago to really manage the island and take responsibility for the items under the 5th schedule of the THA Act.
No, Dr. B. Yisrael, there are two things that are standing out to me right now. The first is that we're looking at the first issue of, I dare say, legal interpretation, particularly, and how it's being brought across. And then also when it comes to communication and collaboration. So given that this is something that has happened moving forward, what is the next step that we can look to start to mitigate this and hopefully effect some sort of collaborative change?
Certainly, and I am glad you were able to be so succinct in identifying the two critical things: looking at the law to ensure that you are actually following the law. And that is all we've been asking for, and communicating. Again, that is all that we've been asking for. The Secretary for the Division of Infrastructure and the Secretary for the Division of Settlements, for example, have been reaching out saying, hey, this is what's happening. We should be working closer together with these things to ensure that we don't have this kind of conflict. What we need to do, though, is for the members of the government to recognize that the Tobago House of Assembly, those of us who were elected by the people of Tobago, the people on the ground are looking to us, and we are the ones who are closest to them. So we are the ones who are hearing what they're saying, and therefore we need to come together to have that kind of collaboration. We are very willing. We've always been open about it. We've always been very clear that that is what we want to do on the other side, and we really continue to ask our colleagues in Trinidad to follow the law and to do exactly the same thing that we are trying to do.
Understood. Let's go to the Tobago allocation. Perhaps we can start particularly with health. I know that in the budget statement that would originally have been put forward by the THA, it was quite detailed when it came to hospitals, ambulances, renal services, waste management and more. And what we also saw coming out of the budget was 23.5 million allocated to the THA for the public healthcare services in Tobago. What are your comments on this?
Certainly. So let me explain what happens at the Division of Health, Wellness and Social Protection. We are responsible for three main entities. First is the health care. So we are the ones who actually send to the Tobago Regional Health Authority their recurrent monies, their DP monies every month to have them running. Most people don't recognize that the TRHA, so the hospitals, the health centers and so forth, it is out of our allocation that they get their funding. So we send at least $42 million every single month to the TRHA to ensure that we have a functioning healthcare system. We also are responsible for social protection, which in essence is what the Ministry of Social Development in Trinidad does. And we are responsible for public health, which is the health inspectors, the garbage collection, and those things. So now that I've outlined that we are talking about three huge areas, you now recognize we're having a DP allocation of a little over $27 million, means that we really, really are going to be stretched. So let me give, for example, when I became Secretary for Health, we found that we had several ambulances that were at the end of their lifespan. We actually started leasing ambulances from a private entity because those that we had were just unsafe. They were not working. We've had situations where the ambulances broke down with people in them. So we were not dealing with that. To procure ambulances means that we needed to spend at least $1 million. I think it's 1.2 million for a single ambulance. With an allocation of a little over $27.2 million, you recognize that it means we could only buy a couple ambulances because we need to do everything else. We need to get the CT machines. We need to get the MRIs. We need to get everything else. In addition to the things that we need for public health, so we need to have our labs up and running. We need to ensure that we can treat with the dengue outbreak that's happening. All of those things are what is coming out of the $27 million for development that is allocated to the Division of Health, Wellness, and Social Protection. Again, going back to a situation where we have $400 million being spent to refurbish a single facility, a single tourism facility, one that's needed. By no means are we saying we shouldn't refurbish that single facility for $400 million. But you recognize again the challenge that we are having when we have to do all of that with $27 million, particularly when, and I'm going to be, controversial about this, particularly when we now see that the Office of the Prime Minister has been allocated close to $50 million to do entertainment and activities. That is more than my entire division when it comes to everything that we need to do to ensure that we are safe and to ensure that we provide health care and to ensure that we do what we need to do on the island. And it is those kinds of conversations, those kinds of comparisons that we need to continually make so that people truly understand how difficult this budget has been for the people of Tobago.
Definitely, of course, a conversation that we have seen many commenting on, and we don't have the details exactly of the breakdown. So we're going to move on and stay within the realm of the conversation when it comes to health and wellness. One of the things that I know is a priority is digitization, which we also saw keen attention was paid across the board when it came to the healthcare system. Now, as you have shared, there is definitely the being stretched thin, for want of a better expression. So how now is this going to take priority, or is it going to take priority at all moving forward with the 2025 budget?
So we have to sit and do a reprioritization. The team is going to pull into a retreat shortly. The other thing that we've been doing, though, is really trying to get external partners who are keen on helping us do some of this stuff. So we do have a couple external partners who are interested in helping us with the digitization part of it. So I do think that that is still going to continue. That is still going to be a priority for us. We just now probably need to go back to them and beg a little bit more because of where we are with the actual amount that is being allocated to us. But the digitization, and when we say digitization, it is of the healthcare system, but we are also going to digitize our social protection system, which allows people who are coming to us for rental assistance, for food support, for clothing, for household items. Let's say you got into a fire or something like that. We are working very, very closely with our partners to digitize that process as well. So that will be an announcement that I hope I can make on TTT very shortly when we roll out the pilot of that.
Well, we look forward to hearing that as well. If it's one thing we do see is the continued work towards progression in Tobago. We just have, I think, maybe roughly about 6 minutes left or so. But one thing that we do need to touch on, which is also an ongoing conversation, is THA debt. Where do you stand on this? What can you share? And thank you so much for definitely bringing a clear definition to everything that we've discussed so far.
Certainly. So when we got into the executive 2.5, 3 years ago, we recognized that there was a debt of over $1 billion sitting there because there were contractors that were, people did things, companies did things, and they were not paid. So we have been trying our best to pay those. So we've been using a two-prong approach. We've been saying to them, we are still in our allocation, we are still picking and trying to pay some of them while doing the development that's needed. But we've also been saying to the Minister of Finance, hey, these are things that we met. These are things that, it's really not our responsibility in terms of the administration. Can you help us? Because it was really your colleagues that procured these services and did not pay them, and honestly did not have a plan to pay them. And the response has not been a very positive one, if I am to be polite about it. The response has been, well, all government does meet debt and all government does leave debt, so you're all to catch. But we are trying to be really, really responsible. We are trying to not be that kind of government that meets debts and just leaves debt. And that is why we have been, pushing at the mid-year review for additional funding to do it. We have also been trying to manage our overdraft because the overdraft fees, because again, we are not getting the finances when we are supposed to get them, even from the central government. Even the finances that are duly allocated, we don't get them as they are supposed to come, which is every 3 months on block. We now have to treat with severe overdraft fees from our banks and so forth. And we are seriously trying to manage that because we are trying to be fiscally responsible instead of just leaving over $1 billion of debt as our previous counterparts did.
Well, again, an ongoing conversation, and thank you so much for sharing that as well. When it comes to moving forward, I know you would have said that you are going to be going into retreat with your team to really, of course, review and see what is going to prioritize. But at the forefront of your mind right now, within your division, what would you say is going to take the main priority for the people of Tobago?
Certainly. Well, there are a couple that we are going to be working on. One is a new initiative known as the Baby Box Initiative, which is basically us saying to our newborn mothers, you guys, we know some of you may be having a difficult time, so here is a cute little box that gives you the essentials so that can help you go forward for a little bit. We are also going to work on a major project that is going to treat with cardiovascular disease that we are partnering with an international entity that we're not ready to announce who is the international entity just yet, but we're doing the background work, and we are hoping that when we work with them to help us prevent cardiovascular disease, diagnose cardiovascular disease, and treat cardiovascular disease, that would also help us to prevent some of the other illnesses, lifestyle illnesses, because the same preventative mechanisms for cardiovascular disease prevent diabetes and so many others as well. So we are hoping to roll that out. And we have a couple other refurbishments that we are working on, particularly our compound, which is the public health compound in Signal Hill. We've been doing some work there, and we want to continue working on our labs up there, continue working on our for task force. We have a building that we are constructing, continue working on that compound generally. So those are the main areas that we want to focus on for now. But as you did say, as I mentioned, we are going to go into the retreat, and then we would finalize those clear projects.
And we look forward to hearing the results of that retreat as well. Dr. Yisrael, before we end our conversation, we're moving now from your division to your general outlook for Tobago for 2025. Can you share with us what your general outlook is and what you look forward to in the future?
Certainly. Well, I don't think I would be allowed to come on this and not plug that we are having our amazing carnival that you guys are partnering with us to broadcast to the world in a couple of weeks. So we'll be looking forward to all of the cultural activities that would happen on the island that would allow us to have more people on the island. And when we say more people, we really mean our first set of tourists, first set of visitors are those coming from Trinidad to enjoy what we have here on the island. I'm excited about that. I'm excited about us continually working together to ensure that we are able to meet those needs. So I am excited to have Cal come to the table and actually say to us, yes, we understand that we need you, that we need people to get to the island, and Caribbean Airlines is one of the best ways to do that, so having them improve on the service there. I'm also really excited for all of the other economic development activities that we are working on. As Deputy Chief Secretary, I was responsible for looking at some of the investments that are coming in. Those are exciting, and those are ones that you're going to see rolling out as well. So we do have some opportunities, and I'm just asking Tobagonians in particular, Trinbagonians as well, to look to Tobago to being the space that could really help the economic development of Trinidad and Tobago, because we really do have the capacity to do it. We just need a little bit of injection into it and a little patience really to help us to get over to that point. But we are excited to be in the union, and we are excited to be a part of developing Trinidad and Tobago.
Well, thank you so much for sharing that, Dr. Yisrael. It's been a pleasure to have you on the show, and we look forward to having you again soon. All the best to you and your team on your retreat.
Thank you. Same to you.